Just to first share with us, what were the symptoms that brought you to see Stephen?
Well, there was nothing. It's not a spectacular story. I was literally just standing up from the couch from a seated position, and my knee locked up on me, and it
Okay.
was incredible pain. And the next day, I had went to a clinic, gave me a steroid shot, some medication, and I suffered for 9 months with that knee pain. It was so intense, and it would bring me to tears. I'd never been so depressed in my whole life with that knee pain, and I went to a clinic in Oklahoma City, a joint clinic that, was talking about doing surgery. They discussed a scope on my knee, and even the doctor there is like, "You're 40, 45 years old. You're kinda too young, 46." I can't remember. And, he said he really didn't wanna do it, so he said, "Let's go ahead and do an MRI." And I was agreeable to it. And I got a call like 3 days before the MRI was scheduled from the insurance company, says, "Hey, you really need to go see Steve at IMC before we can approve the MRI." And I was like, "What?" I was really disappointed because I did not know he existed. I didn't know
Mhm.
that his service was available to me the whole 9 months that I had been suffering.
Oh, gee.
And
Yeah.
yeah, and my husband works for Michelin,
Okay.
and so I called him that day, and I was because this was a surprise that I had to have this, clearance to get the MRI done,
Hmm.
and so my husband talked me into going. So I came in, and Steve said, "Just please trust me." He explained everything that was going on, and honestly, my thought was, "What do I have to lose?"
Yeah.
So I started seeing Steve and, I mean, doing the exercises, and I feel amazing now.
Okay. So before we jump into your experience with Stephen, I want to go back to the original, uh, uneventful getting up off the couch, right? When we're young, it's spectacular events
Yeah.
that cause us injuries, but when we get older, it's just getting up off the chair, right? So where was the pain, Mary, exactly? Was it in the front of the knee or the back or?
It was in the front, medial side.
Okay, to the inside toward the kneecap on the front side. And
Yeah,
and it was a sharp pain that you had never had before.
yeah.
Yep. And it persisted. And you went to see, what did you say, urgent care or a walk-in
More or
clinic?
less, yeah,
Okay.
more or
All
less,
right.
urgent
And what were you told at that time?
arthritis. Arthritis and a
Because,
spur,
okay.
bone spur.
So you got an x-ray that day,
Yes.
and the clinician you saw, the doctor, the nurse practitioner, whomever, saw, yeah, nurse practitioner, they saw some arthritis and a bone spur on your image and told you that.
Yes.
Okay, you're a nurse, so you've got some training, some knowledge about this. What was
Yes.
your impression of that message to you, that diagnosis?
That it was it was terminal.
Really, it was pretty,
This is the way it's gonna be for the rest of my life. It was just because when I hear arthritis, I just kinda like, well, that's the beginning of the end.
okay, yeah, the nail in the coffin, huh? So you were kind
Yes.
of expecting, okay, from this point forward, I'm just going to deal with more symptoms as I get older. It's going to get worse.
Yeah. Yeah,
Were you
she
ever
had even suggested that I'll probably need surgery down the road to clean out the joint and maybe, she wasn't I don't wanna she wasn't very helpful.
I see. Yeah. Yeah. Just kind of gave you an outlook, huh? Now, you had this pain that was medial, front of the knee. What
Mhm.
kind of things was it affecting you? How was it affecting? How was it limiting you? In what ways was it bothering you?
It would lock up, randomly, and I fell 3 times. Like, I would just be walking, and twice was in front of patients. That was so embarrassing. The other time
Oh, no.
was in the parking lot as I was opening my car door. I have a scar on my forehead where I fell into my car door.
Oh,
I
no.
mean, it was bad.
So the leg actually would buckle, give way.
Yes. Yeah, I
Yes.
had
But it
no
would also
control.
lock.
Yeah,
It
when
would
I would
lock
walk.
up.
Mhm.
Okay. Like it would be bent and you couldn't straighten it, or straighten and you couldn't
Correct.
bend it?
It was just like I couldn't move it. The pain
Okay.
was too extreme.
Okay. And then at some point later, it just finally start easing up and then you could move again.
Yeah, most of the time I would have to let myself set, rest, you
Yeah.
know, wiggle my toes.
Yeah. Wait on
Anything
it,
I
huh?
could.
Right. Was it affecting you when you weren't up and moving around? Were you fine when you would sleep or lie down or sit?
It would affect my sleep, yes, absolutely, because they're just like just ache so bad. I lost a lot of sleep that 9 months.
Okay. All right. And then, you've got a personal life as well, besides being at work and falling in front of patients or falling into your door. How is it affecting routine social life? Would you kind of think whether or not you could go and be with family, friends?
I hated my family would like to, go to Oklahoma City or Denton, go out and do things, and I didn't wanna go, or I would sit in the car while they went and shopped because I didn't want it to start hurting halfway through and then have to walk all the way back. We also garden and do yard work, and
Yes.
I could participate in that.
Okay.
It was very dismal.
Yes. Yeah. And so, and you said 9 months, but how long between the initial diagnosis of arthritis in a bone spur to when you went to see the specialist, the orthopedist?
Um, it was probably about 6 weeks before I met Steve, or
Sorry. Yeah. How long before you saw the specialist, the surgeon? Did you see a surgeon?
yeah, it was about 6 months before my appointment, or 6 weeks before my appointment with, Steven.
Okay.
So 7 months,
So
thereabout.
7.5 months,
Yeah,
roughly,
correct.
likely from where it began.
Uh-huh.
Okay. But I'm trying to understand the time frame between the
Why it took so
walk-in
long?
clinic. Well, no. The time frame between the walk-in clinic and the orthopedic surgeon. Was that
He
all one, was that all one person or is that two different visits?
The walk-in clinic was just, it was just nurse practitioner, and then, um, finally broke down because now I actually went to the nurse practitioner twice in
Okay.
the initial 7.5 months, and she gave me a second round of steroids and other anti-inflammatories. The second round didn't help, and so finally I just decided that I had to see an orthopedic surgeon. Unfortunately, they're so booked out, it took me that long to get into his office.
So 7 months later, 7.5 months or so, that's when you saw the orthopedic surgeon.
Yes.
Okay. And so the MRI then was done or
No, scheduled.
was ordered, yeah, scheduled, but you knew you had to see Stephen. Okay, sorry about that, and thank you
Sorry,
for
no,
clarifying.
sorry.
Yeah, you're good. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.